Hello, good morning. Today's topic is organic irritant poison from animal origin. So let's start. Organic irritant poison from animal origin. In last lecture we have discussed about organic irritant poison from plant origin. They are similar to bacterial toxin like endotoxin and exotoxin, etc. About Ricinus communis, Calotropis, Semicarpus anacardium, Ebrus precatorius, etc. Now today we discuss about organic irritant poison from animal origin, which include snakes, canthrids, scorpion, bees and wasps, centipedes, spiders and lizard. All these are animal are day to day are you see during in a village area in as well as in city area also. Now snakes, organic irritant poison, animal origin. It has been divided into 5 family. One is Elapida, second is Hydropida, third is Colubrida, fourth one is Viperida, and fifth one is Atractus pipidida. Viperida is divided into subfamily Viperina and Crotalina. So first is Elapida. Elapida means having a hard fang like our teeth, but instead of canine there is a long fang. It is poisonous fang. It is a hard fang. That's why it is Elapida. Hydropida, its name suggests its family. Hydro means related with the water, so it is water snake. Colubrida, most of the snake belongs to Colubrida family. Colubrida family is a mostly non-poisonous snake, but some snakes having a back fang. Back fang means in our teeth there is a molar, while in snake instead of molar there is a poisonous fang on back part of mandible. While in Elapida and Viperida, fang are instead of canine, while in Colubrida it is back fang. But most of the snake from the Colubrida are non-poisonous. Now Viperida divided into 2 subfamily, Viperina and Crotalina. In Viperida family, it is a folded fang. When it is going to bite, the fang mark are erect, while when the mouth is closed, the fang are folded. So it is a Viperida family having a folded fang. Now, what is the difference between Viperina and Crotalina? Viperina not having a rattle. You find in America, North America and South America, there is a rattlesnake, which is a characteristic of Crotalina family, and pit viper. Now, important poisonous land snake in India: Russell's viper, Sow-scale viper, common cobra, Indian crane. These are the most poisonous snake found in India. Now, let's discuss about the character of Russell's viper, also known as a Kandar, Chital, Kadchitro, having a diamond-shaped body scale, triangular head. You see in photo, there is a triangular head and the marking of V. The pointed is forward and short and narrow tail. 3 row of diamond shape over body scale. This is Russell's viper. Now Sow-scale viper, also known as Hursa. Same, having a triangular head, but instead of V, there is a bird footprint or arrow-like mark, white mark over the head. In Russell viper, there is a V mark which is pointed forward, while in Sow-scale viper, there is a bird's footprint over head. This is the characteristic of this Sow-scale viper. Now, black color area between white line. There is a white wavy line on both side of flank area of the snake. And between these two white wavy line, there is a black color diamond shape area. And the so like middle ridge. The body scale of the middle part, it is like a saw. So itself gives the name saw scale viper. Now, the most commonest cobra. Most of the you have seen the cobra, also known as a nag, kala sap, naja. It has a hood. There is a spectacle mark on the back of the hood, double or sometimes single spectacle mark. It is also known as a monocellate or double cellate. The fourth one is common crate, also known as a kadotro, chitkabaryo. These are the local name. Having a shining steel black color or steel blue color, single white arch, and the belly scale is a creamy white belly and rounded tail. The single white arch are in upper part are not distinct, but in the rest of the half part it is distinct. Can you see in photograph? Now this one is banded crate, also known as a ahiraj. Same as a common crate, but there is a alternate band of yellow and black color over the body. That's why it gives name to banded crate. Rest of the characteristic are same as common crate. Now this one is pit viper. Pit means there is a one opening between eyes and nostril. Mostly it is a heat sensor for snake. This is known as a pit viper. It belongs to a Crotalina family. Now difference between poisonous snake and non-poisonous snake. Poisonous snake teeth mark. There is a two fang mark in a poisonous snake, while in a non-poisonous small teeth but no fang mark. Now teeth. Now poisonous teeth, how it secrete the poison or insert the poison into the enemy. There is a two type of poisonous fang. One is canalized and having a second one is groove, long, hollow and groove like a hypodermic needle. So canalized, it is opening throughout its fang, while in groove there is a one side is a open in a fang. Non-poisonous snake, short, stout and non-canalized. Now head and head scale. Difference between poisonous snake and non-poisonous snake. In non-poisonous snake, head is triangular, head scale is small. In non-poisonous snake, head is rounded or oval and head scale is large. Most of the head scale is large. Belly scale, the most important, you can see when the patient comes with dead snake, which snake is bitten to him. You reflect on back side on belly part and you can see the belly scale. Poisonous snake having a broad cover entire breath, while non-poisonous snake the belly scale small and do not cover entire breath. If you see the dead snake on back part or frontal part, the belly scale are small and do not cover entire breath, then it is non-poisonous. The patient required assurance and symptomatic treatment. Now tail of the poisonous snake and non-poisonous snake. In poisonous snake, single row of anal plate and plate is compressed, while non-poisonous snake is double row anal plate and end plate is not compressed. Difference between poisonous and non-poisonous snake. Now trait. Poison. Fang hollow like hypodermic needle or canalize. You see in a back slide there is a canalize or groove type fang mark, while in non-poisonous snake short, stout and non-canalized. Belly scale large, cover entire breath. In a non-poisonous snake small, do not cover entire breath. Now head scale. In poisonous snake head scale is small, while in non-poisonous snake head scale is large, except in poisonous snake. In pit viper the head scale is large with pit having a pit. Second one is cobra having a hood or spectacle mark, and crate fourth infralabial scale is largest. So these are the exception. In a poisonous snake having a head scale is large. Now head is triangular, while in non-poisonous snake head is rounded or oval. Teeth two long fang, several small teeth. Habits usually nocturnal, not certain. Now difference between cobra and viper. One of the important difference is cobra belongs to Elapida family and viper belongs to a Viperidae family. Body is long and cylindrical, viper short and wide. Head is small, continuous with body covered by large scale, while in viper large, broader than body covered by small scale. Pupil circular, while in viper having a vertical slit. Fang short, fine and groove, meant hard fang, while in viper long and slender and folded fang, like this. Folded fang. Upper jaw contain fang, other small teeth, while in viper contain only folded fang, no small teeth. Biting pattern cannot bite through the cloth, can bite easily. Venom neurotoxic, while in viper the venom is vasculotoxic. Now reproductive pattern. It is oviparous, means cobra lay eggs, while in viper it is viviparous, give birth to young one. Now this is the picture of venom apparatus of viper. It is a folded fang. See, looks like a hypodermic needle. Venom ejected from venom canal, close up of fang, and above the tip there is a opening, from it venom excreted. Now fang in this snake head photo, this is venom gland, compressor muscles, protective sheath, means mucus. Folded fang is covered by mucous membrane, protective sheath. Fang secondary venom duct, accessory gland, primary venom duct and brain. Fang, this is the viper. Venom apparatus of Russell's viper. Venom gland, venom duct and fang. It is looks like a hypodermic needle. Now extraction of venom from in a laboratory for making antisera. They use glass breaker, elastic band and latex membrane. From it, milking of venom from viper's mouth. Now venom composition. Venom means it is the saliva of the snake. Saliva of the snake, also known as a venom, from both modified parotid gland of upper jaw, according to constitute and according to effect on body. According to effect on body, it is divided into neurotoxic, cobra and crate, means Elapida family. Vascular toxic, easy viper, means Viperidae family, and Hydrophida means sea snake, myotoxic, means related to poisoning to causing muscle paralysis. Now according to constitute, more than 90% of the snake venom dry weight is protein, means saliva in a dry weight. More than 90% of snake venom is protein. Each venom contains enzyme, non-enzymatic polypeptide toxin, non-toxic such as nerve growth factor. Now enzyme and its effect. Phospholipase A, protease, lecithinase, hemorrhagines, damage vascular endothelium, bleeding, fibrin procoagulant enzyme, increase coagulation, consumption, coagulopathy, hyaluronidase, spread of venom through tissue, agglutinin causing agglutination of RBC, hemolysin causing disruption of endothelial cell, alveolar septa, causing bleeding, pulmonary congestion. Now second one is polypeptide toxin, neurotoxin, phospholipase A2, lecithinase, neuromuscular depolarizing agent, paralysis of the respiratory center. Cholinesterase causing presynaptic neurotoxic activity, impaired neuromuscular transmission, which leads to paralysis of respiratory center. Now fatal dose, fatal period and amount of yield in one bite. In single bite, how much poison or how much venom is injected or excreted from the snake. From snake, first one is Cobra. Fatal dose of dry venom 12 milligram. Fatal period is 0.5 to 6 hours. And in a single bite, the 200 to 350 milligram of dry venom are excreted from single bite. It is more than 20 to 22 times higher, more than 22 times higher than fatal dose. Now from crate, it is less required 6 milligram. Fatal period not certain, and in single bite 20 to 22 milligram in a single bite. Russell Viper 15 milligram. Fatal period 1 to 2 days. In a single bite 150 to 200 milligram. Sourcecale Viper 8 milligram 1 to 2 days and 20 to 30 milligram. Now store of venom does not exhaust, not less venomous even after several strikes. Concentration of venom show diurnal variation. Night and immediately after hibernation most severe. Snakes are belongs to a cold-blooded. During winter they are hibernate into the land, but in a summer they are come out from the land. So it is immediately after hibernation it is most severe, and in night it is also most severe. Venom spread through lymphatic and superficial vein. After bite, the venom is spread through the lymphatic channel and from the superficial vein into the systemic circulation. Now sign and symptom, also known as ophiotoxemia. What is ophiotoxemia? Sign and symptom produced by snake venom poisoning or snake bite. Now first of all, you have to confirm whether snake bite occur or not, because in most of the area or most of the peripheral center in a night when a person go to farming, person came with a history of something bite. So it is decide whether it is have to decide whether it is a poisonous snake bite or non-poisonous snake bite or snake bite itself or something else. Now confirming the snake bite, you have to first general symptom for non-venomous and venomous bite history, flushing, palpitation, sweating, anxiety and fear. Prominent feature in any snake bite victim means whether it non-poisonous or poisonous or sometimes in a something bite history. There is a history, person having a psychological symptom, flushing, palpitation, sweating, anxiety, fear prominent. Now establishing species. When it come to that it is a venomous snake, now you have to go to establish the species whether from Elapida means neurotoxic, vascular toxic or myotoxic. Now specific feature of venomous snake depend upon type of snake, consistent of local and systemic feature of envenomation. Now this is bites from Elapida means crate and cobra. Local effect, minimal sign and symptoms at the bite site means local part. Swelling, local pain or local necrosis in cobra. Systemic effect. Cobra belongs to the neurotoxicity. Cobra and crate causing neurotoxicity. So its systemic effect on neurological. First one is drowsiness, paresthesias, abnormality of taste and smell, ptosis, external ophthalmoplegia, paralysis of facial muscle voice, aphonia, regurgitation through the nose, difficulty in swallowing, respiratory and generalized flaccid paralysis. Now, person has to look up if upper lids retract fully or not. Taste eye movement, early external ophthalmoplegia, size and reaction of the pupil. Now paradoxical respiration, intercostal muscle paralysis. In a crate there is a stomach pain, submucosal hemorrhage in stomach. Crate bite present in early morning with paralysis can be mistaken for stroke. Now symptoms and sign of viper bite. Local features, severe pain, redness within 10 minutes of bite, within 15 minutes, swelling, blood stain, persistent discharge within 12 hours, continuous bleeding or oozing of blood from the bite mark, it gives rise to a viperine bite. Why? It is a vascular toxic. Due to coagulopathy, there is a continuous oozing of blood. Appearance of blisters, swelling progress, swelling non-tender, and there is a two fang mark. You can see in a picture two fang mark, also swelling. In second picture you can see blister, swelling, redness, and as well as blister. Now systemic features in viperine bite, skin and mucous membrane, petechia, purpura, discoid, hemorrhage, ecchymosis due to coagulopathy, bleeding and clotting disorder, ecchymosis, epistaxis, hemolysis, subconjunctival hemorrhage, gingival sulci bleeding, evidence of coagulation dysfunction. Now muscular system, generalized pain, stiffness, tenderness, triasmus, hyperkalemia, renal, lower back pain, hematuria, hemoglobinuria, myoglobinuria, oliguria, anuria. Hematuria, hemoglobin due to hemolysis of the blood. Endocrinal, in acute phase, shock and hypoglycemia. Chronic phase, months to year after the bite, weakness, loss of secondary sexual hair and libido, amenorrhea, testicular atrophy, hypothyroidism, etc. Now trade. Colubrine bite, not colubrine, it is Elapida bite and viperine bite. Symptoms, neurotoxic in viperine bite, vascular toxic, area bitten, reddish, wheel, tender with slight pain, less oozing of blood stained fluid. In a vascular toxic, pain and oozing of blood stained fluid continuous. Swelling minimal or absent in bitten area, while in a viperine bite, over limbs spread up to the trunk. Speech and deglutition difficult, while in viperine bite normal. Why? Because it is not a neurotoxic, while in a Elapida bite it is a neurotoxic. Paralysis, lower limb, trunk or head. Viperine bite not present. Salivation present, while in viperine bite absent. Pupils normal, while in viperine bite dilated. Blood pressure normal. Due to blood loss coagulopathy, it is hypotension, bleeding and clotting time normal, while in viperine bite, bleeding and clotting time prolonged. In Elapida bite, hemorrhagic manifestation not present. Why? It is a neurotoxic. While in viperine bite, hemorrhagic manifestation prominent, continuous oozing of blood. Cause of there is a respiratory failure, while in a viperine bite, shock and hemorrhage. Wow. Now bite by sea snake. Usually painless, minimal or no local swelling. Early symptom headache, thirst, sweating and vomiting. Generalized rhabdomyolysis dominating effect. Generalized aching, stiffness, tenderness of muscle between 30 minutes to 3.5 hours after the bite. Trismus is common. Myoglobinemia and myoglobinuria. 3 to 8 hours after the bite, serum and plasma become brownish, urine dark reddish color, Coca-Cola color. Damaged skeletal muscle release myoglobin and potassium. Acute renal failure occurs, and due to renal failure, hyperkalemia develop within 6 to 12 hours and precipitate cardiac arrest. Progressive flaccid paralysis starting with ptosis, as in Elapid. Patient remain conscious until the respiratory muscles are sufficiently affected to cause respiratory failure. In Elapida, it is neurotoxic, while in Hydropida means water snake causing myotoxicity, means it directly causing paralysis of muscles, while it's in Elapida it is due to neuromuscular junction. Now management of snake bite. First aid treatment, transport to hospital, rapid clinical assessment and resuscitation, detailed clinical assessment, investigation, laboratory tests and antivenom treatment. Observing the response to antivenom, deciding whether further dose of antivenom are needed, support, ancillary treatment, treatment of beaten part, rehabilitation, treatment of chronic complication. Now first aid treatment means reassurance whether the having a snake bite or not, whether it is a poisonous or non-poisonous. Performed by the snake bite victim himself or herself by anyone. First aid treatment, not to do, never make local incision or pricks or puncture at the tattooing, like tattooing at the bitten site. Sucking the venom out of the wound, not to suck venom from the wound. Have you seen in a movie, person suck the venom and person survive? It is fact. Sucking the venom, spread the venom. Local incision or pricks, never make local incision. Use of black means snake stones. Don't use. Tying tight bandage, tourniquet or electric shock. Not too much tight band over the wound site. Topical installation and application of chemical herbs or ice pack, not to install or apply. Not vigorous cleaning, massage or movement of the limb. Massage and movement of the limb causing spreading of the venom. Now recommended first aid method. Reassure the victim, give psychological support. First of all, immobilization of the patient body by laying in safe position. In this photo, left lateral position. In this position, person can sleep or rest. That's why left lateral position is useful. Immobilization of the patient body by laying in safe position. Now, using tourniquet. It is also Sutherland tap. Tourniquet prevents spreading through the superficial vein and lymphadenum. Why superficial tourniquet? Because the snake venom is spread through lymphatic channel and superficial vein. So superficial tourniquet prevent the superficial vein and lymphatic. Apply tourniquet proximally heart, not too tight, which occlude the superficial. Apply tourniquet tight enough to occlude superficial venom and lymphatic, not too much tight, which occlude the deep vein. Distal pulsation should be appreciated. Immobilize the beaten limb with a splint or sling. After 30 to 40 minutes, release the tourniquet for 5 to 10 minutes. Now, transport to the hospital. Ensure safe and convenient journey. Time factor is a prime importance for the patient, whether survive or not. Rapid primary clinical assessment and resuscitation. A, B, C, D, E approach. A means airway, B means breathing, C means circulation, D means disability of the nervous system, E means exposure and environmental control from cold, risk of drowning. Airway protection and management. Basic airway management using the head tilt, chin lift and jaw thrust maneuver. Dislodge the tongue and reopen the upper way. Advanced airway management. Maintain and protection of airway for a long period in paralyzed patient if high concentration of oxygen up to 100% required. Detailed clinical assessment. Examination of the beaten part. Palpation start proximally. Extent of swelling. Doppler ultra intra-compartmental pressure, blood flow and artery vein assessment. Early sign of necrosis. Blistering, demarcated darkening means bruising query. Paleness of skin, loss of sensation, smell of putrefaction, rotting flesh. So, how to clinical assessment done? By palpation, by Doppler ultrasound, early sign of necrosis. Now features. Local pain and tissue damage. In Cobra present, yes. In crate, no. Russell Viper, yes. Source scale Viper, yes. Ptosis, neurological sign. Cobra, cat and Russell Viper, yes. While in source scale Viper, no. Hemostatic abnormality, no. While in both Viper, yes. Renal complication present only in Russell Viper. Respond to neostic mind only in Cobra. Now investigation laboratory test. Bedside test, 20-minute whole blood clotting test, 20 WBCT. Use only glass container, not to be cleaned with any chemical. Clotting factor may stimulate. Method. Press 2 ml fresh venous blood in a dry glass container. Leave undisturbed for 20 minutes at the ambient temperature till the vessel once. Incoagulable blood venom bite. If the blood is incoagulable, it is a venomous bite. If doubt, repeat the test, duplicate, including a control. If the blood coagulated in a glass container, then it is a no venomous bite. Now other test. Platelet count decrease, bleeding time increase, clotting time increase, plasma fibrinogen low. Helpful in differentiating between vascular toxic and neurotoxic. White blood cell count and early increase in neutrophil count. Blood fragmented red cell, handmade cell or schistocyte are the seen due to microangiopathic hemolysis. Plasma serum pinkish brownish hemoglobinemia or myoglobinemia. Biochemical abnormality. Aminotransferase and muscle enzyme. Creatinine kinase aldolase elevated. Severe local muscle damage, generalized muscle damage, hepatic dysfunction, increase in bilirubin due to extravasation of blood, renal function test, creatinine, urea are raised, early hyperkalemia due to blood loss, extensive rhabdomyolysis in a sea snake, low bicarbonate, renal failure, hyponatremia due to crate bite. Now, indication of for antivenom means how to decide whether antivenom is required or no. Hemostatic abnormality, spontaneous systemic bleeding, thrombocytopenia, neurotoxic sign, ptosis, external ophthalmoplegia, paralysis, cardiovascular abnormality, hypotension, shock, cardiac arrhythmia, abnormal ECG, acute renal failure, oliguria, anuria, generalized rhabdomyolysis, dark brown muscle ache, pain. These are the indication for introduction of antivenom. Local symptoms also. Local swelling over more than half of the bitten limb in the absence of tourniquet within 48 hours of the bite. Swelling on the digit, toes and especially finger. Rapid extension of swelling. Enlarged tender lymph node. Now, antivenom. Introduced by Albert Camus. Preparation. How it prepares. Preparation: inject venom less than fetal dose in horse, mule or sheep. Development of purified immunoglobulin IgG in plasma, purified and dried and sealed in vial. Storage of venom: lyophilized form, means dry powdery form, less than 25 degree for 5 years. In a liquid form at the 2 to 8 degree up to 2 to 3 years. Liquid form must not be freeze. Now, type of antivenom: monovalent and polyvalent. In India, mostly polyvalent anti-snake venom serum are used against the Cobra, Crate, Russell viper and Sourcecale viper. While what is monovalent? Specific antivenom against the specific species, like antivenom of Cobra bite. When monovalent antivenom is useful when the person confidently know which type of snake bite occur, whether it is a Russell, whether it is a Cobra. Less expensive, while polyvalent is more expensive. No para-specific activity, more potent. May have para-specific activity, less potent. Given in a cases species identified. Gives when difficult to identify to the species. In India, it is mostly difficult to identify in a night. What is paraspecific activity? Antibody raised against the venom of the one species may have cross neutralizing the activity against the closely related species. Now, antivenom hypersensitivity test. Before introduction of the antivenom, you must carry out antivenom hypersensitivity test. Otherwise, person died due to hypersensitivity reaction due to anaphylactic shock. So, first of all, 0.05 to 0.1 ml of 1 into 10 gm dye solution of serum injected intradermally. Positive reaction occur within a 5 to 10 minutes. Appearance of wheal and surrounding to erythema, it gives a positive hypersensitivity reaction. This test may reveal IgE mediated type 1 hypersensitivity reaction to horse. Now what to do? It is the one of the antagonist or anti-snake venom. You have to introduce with desensitization of the with drugs. Subcutaneous injection of the 0.5 to 1 cc in a 1 into 100 solution of serum every 1/2 hourly till the reaction subside. Limitation of hypersensitivity test. Do not predict the large majority of the early anaphylactic or late serum sickness type antivenom reaction mediated by direct activation of the complement system. Who has recommended that the intradermal skin testing should not be used before administering ASV. Done if patient is stable and time available. Now, antivenom reaction occurs in 20% of patients. Duration 10 to 180 minutes. Pyogenic 1 to 2 hours. Late 1 to 12 days. Mechanism competitor activity IgG mediated. Contamination during manufacturing. Symptom each urticaria, dry cough, fever, GI disturbance, rigor, fever, fall in BP. While in late arthalgia, myalgia, autoimmune disease type. Prophylaxis, prevention and treatment of antivenom reaction. Pre-treated with subcutaneous epinephrine, intravenous antihistamine and corticosteroid. Epinephrine, adrenaline 0.1% solution in 1 into 10 should always be drawn up in readiness before antivenom is administered. Dose should be further diluted in isotonic saline and restarted as soon as possible. Concomitant IV infusion of epinephrine may be required to hold allergy sequel at bay while further antivenom is administered. Means you have to introduce antivenom as well as epinephrine. Now, administration of antivenom. Antivenom should be given by the intravenous route whenever possible. Local administration at the site of bite is not recommended. Intramuscular injection not recommended. Painful, slow absorption, necrosis can be given it at periphery. More time to reach hospital if intravenous site not accessible. Intravenous push injection, intravenous infusion, 2 types. Preparation, reconstituted freeze dried antivenom or neat liquid antivenom is given by slow IV injection, while in a solution means infusion diluted in 5 to 10 ml of NS or 5% dextrose. Rate of infusion 2 ml per minute over a period of 1 hour. Advantage, economical, fast acting, comparatively costly, act slowly. Disadvantage, anaphylactic reaction if occur develop rapidly. Anaphylactic reaction occur can be controlled in a IV infusion. Now dosage, minimal, local swelling, no systemic reaction. 5 vials required. Moderate symptom, swelling plus systemic reaction, 10 vials required. Severe symptom, 10 to 15 vials. Now timing and effective of anti-snake venom serum. Based up to patient reach up to within a 4 or up to 6 hours. Less value up to 8 hours and doubtful after 24 hours. Observation of the response to antivenom. General symptom improved. Sometimes placebo effect may be occur. Bleeding from the gums usually stop. Restored in 3 to 9 hours. 20 minutes WBCT, whole blood coagulation time. Blood pressure may increase. Arrhythmia resolve. Neurotoxic symptoms improve. Active hemolysis and rhabdomyolysis may cease within a few hours. Reoccurrence of the symptom due to continuous absorption of venom from the bitten site. Improve blood supply, correction of coagulopathy. Criteria for repeating the initial dose of antivenom. Persistence or recurrence of blood coagulopathy in patients who continue to bleed briskly after 1 to 2 hours after first dose of ASV. Deteriorating neurotoxic or cardiovascular sign after 1 to 2 hours of the first dose of ASV. Now supported treatment in a neurotoxic snake bite. Means Cobra bite. Give atropine sulfate 0.6 mg for adult and 50 microgram per kg for children IV plus neostigmine bromide 0.02 mg per kg for adult and 0.04 mg per kg for children IM. Improve neuromuscular transmission ventilatory capacity. Before atropine, after atropine. In vascular toxic snake bite, heparin and fibrinogen which counteract the hemorrhagic manifestation. In myotoxic snake bite, large amount of IV fluid, large amount of protein dialysis. Treatment of beaten part, tetanus toxoid, antibiotic, intra-compartment pressure. If more than 40 mm mercury, physiotomy after correction of coagulation. Rehabilitation, limb should be maintained in a functional position. Conventional physiotherapy which accelerates the functional recovery. Now what is the postmortem appearance? Finding common to all snake, external throat and mouth and nostril, all internal organs show congestion, pericardium, purpuric spots, pulmonary edema, intracranial hemorrhage. Treatment of beaten part already discussed. External finding, trade. In colubrine bite, radius will tender. Elapida bite, radius ill, tender, slight pain, less oozing of blood-stained fluid. While in viperine bite, pain and continued oozing of blood. Swelling, minimal absent in beaten area, while in viperine bite, over limb spread up to the trunk. Pupils normal, while in viperine bite dilated. Internal finding, hemorrhagic manifestation, cause of death, respiratory failure. Hemorrhagic manifestation in elapida bite not present, while in viperine bite present. Cause of death is respiratory failure in a elapida bite, while in a viperine bite shock and hemorrhage. Now sample collection. Routine viscera collection in preservative, 3 bottles plus for chemical analysis. If you are not sure about whether it is a snake venom poisoning or not, otherwise in a nowadays no viscera is required. In a clear cut snake venom poisoning having a fang mark on a local examination, you find a hemorrhages and necrosis of the beaten area in a dead body. Skin and underlying tissue surrounding the bite marks should be removed, placed in saturated solution of common salt for chemical analysis. Cause of death, hemorrhagic shock in viper, in cobra and crate, respiratory failure due to paralysis of respiratory muscle, in sea snake due to renal failure, vasovagal shock, late septicemia, multi-organ failure. Now medico-legal importance, manner of death, accidental, common site are lower distal extremity, upper distal extremity. Homicidal, casting aged snake on the other person as cattle poison through smear rag. Suicidal, Queen Cleopatra from Egypt is known to be suicide by cobra. Now compensation, snake venom has no ill effect taken orally, provided no ulceration of GI mucosa. Now canthrites.